Sorry, we may end up having two recordings. Rob started on his computer, but it
Uh,
stops.
okay. So thanks for the invite. I think there was a bill. This came out of a building electrification breakout at the CCL National Conference when I was on a panel and I made some comments about cooking with gas and how that was bad for your health. And so here we are. I've actually been working on this for the last couple of years with Physicians for Social Responsibility. Um, I've taken a pretty active role in pushing for policies to get gas out of the home, and both for the climate impacts, which is predominantly driven by how you heat your space heating and water heating, and then the very direct health impacts, um, which is primarily related to cooking, and that's what I'm going to talk to you all about this evening. So what I'd like people to walk away with is to understand how cooking with gas produces indoor air pollution and the health impacts of that air pollution. I also want folks to recognize how the risk of bad indoor air depends on other factors, um, such as what your outdoor air is like, such as the size of your home. And as you might guess, children, the elderly, and lower income populations are particularly vulnerable. Um, and we'll talk a little bit about some solutions and what you can advise your patients to do if they have gas in the home to reduce their risks. Um, so first question, and I guess, um, yeah, I think we could do raised hands. What's the first thing that comes to mind when you think of a gas stove?
Good chefs.
Chefs, good. Anybody else? Well, I used to think of cooking with gas as a good thing. I mean, you're cooking with gas, you're doing well. A lot of clean burning, And I remember when we moved to our home when it was new 23 years ago, I was like gung ho. I was super glad that we had a gas stove because that was the way I had this belief based on years of conditioning that it was superior for cooking to electric cooking. And really didn't, even though as a physician, didn't know that actually um, the gas stove was actually dangerous. Um, so common pollutants from cooking with gas, nitrogen dioxide, carbon monoxide, and particulate matter. Um, Health effects. So uh, oxides of nitrogen are pretty strong promoters of both chronic airway inflammation, asthma, and acute asthma exacerbations, and a increased susceptibility to respiratory infections. Um, it's really the worst actor if you're looking at cooking with gas and say childhood asthma. But it's also a risk factor for heart attack and stroke in adults and associated with reduced cognitive function when you're exposed to nitrogen dioxide. Carbon monoxide, yeah, we all know some of this about carbon monoxide poisoning. Uh, low levels cause some fatigue, confusion, dizziness, nausea. Higher levels can result in coma and death. Uh, and in people with underlying heart disease, even non-lethal levels of carbon monoxide poisoning can cause exacerbation of angina. Um, and then my favorite are the particulates. And particulate matter um, causes neurologic effects, memory loss, can actually lead to dementia, we think. also aggravates asthma and increases respiratory symptoms from asthma and COPD. Also contributes to acute myocardial infarction, cardiac arrhythmias such as AFib, and exposure to particulates is associated with premature death in people with underlying heart or lung disease. It's just the sort of stuff you want kind of swimming around your kitchen. And the levels of these pollutants indoors they're not trivial. And if we look at the outdoor standards from, say, the EPA, the state of California, the Canadian standards, and compare what we see if we're using an unventilated gas stove. So if you are in a 1,500 square foot living space, 83% of the time when you cook, you exceed EPA standards for outdoor air. In other words, like if there's a factory emitting 100 parts per billion of, say, nitrogen dioxide, and it was detected, they would be fined. Uh, um, but the indoor air is not regulated. There's no EPA standard for indoor air, but the same toxins are emitted at this level very frequently. When you go to a less than 1,000 square foot home, essentially you can't cook without exposing yourself to toxic levels of pollutants. This is data from the Lawrence Berkeley Laboratory, where what they did was measured nitrogen dioxide throughout the day and cooked several meals using either roasting or a gas cooktop. And as you can see, levels go up when you cook. After you cook, they drift back down, but not down to that baseline. And so through waking hours, you would be exposed to, repeatedly to levels above that 100 parts per billion, which is the EPA cutoff. It gets worse. So there is a study looking at gas stoves in homes, even when they're turned off. And they took samples of the gas as it was flowing into the home. 99% of homes had benzene in the gas at concentrations known to be carcinogenic. And the bad thing is that benzene is really prone to leaking, and you don't have to turn the stove on. So you get this potent carcinogen leaking into your air even when it's turned off. Furthermore, the gas we burn in our homes is predominantly methane. So when there are gas leaks, and there are, you're allowing a chemical that has 84 times the heat trapping effect of CO2. So there's just a ton of reasons to try to get ourselves away from, using this stuff in the home and elsewhere. Focusing in on childhood asthma, this is really been the best studied disease in terms of cooking with gas, and nitrogen dioxide clearly shown to have a concentration dependent increase risk of asthma. The similar findings have been shown with ozone and with particulates. And I just took a quick look at the chat in case there's a question there. I guess, Lori, I'm going to trust you to do that and interrupt me if there is. Next. So another way to look at this is, just forget about which of the toxic substances are responsible. Just look at what happens to kids if they live in a home that uses gas for cooking. And there's a 35% higher. I had my incidence of asthma diagnosis. and a 42% higher prevalence of symptoms. So, in other words, the kids that have it are more apt to have it worse. Um, Another analysis looked at the percent of cases that could be attributed to gas cooking. I'm not a super fan of this math in terms of trying to explain things to people, but uh, because there's multiple factors, right? There's no pure asthma just because of gas cooking, but 12% of the asthma in children in the United States is because of gas cooking. I guess that's the best way to explain that. Um, so we could do our kids a big favor if we switch to electric cooking. Um, why are the kids particularly vulnerable? They breathe at a higher ratio. They have a higher lung to body ratio. Their immune system is still developing. They're more physically active. Uh, and so exposures that in a kid are usually going to have worse consequences. Exposures to airborne toxins are going to have worse consequences in kids than in adults. Um, and turns out that your parents' income, where you live, has a big impact on this. So childhood asthma in 22% of kids in public housing have childhood asthma versus less than 7.5% in private homes. Black kids have higher rates than Caucasian kids. And income, really big driver. If you compare folks at 100 below 100% of the poverty level, that's a 12% incidence of asthma. You look at people at four and a half times the poverty level, it's only 6%. So wealthier kids have healthier lungs. Doesn't seem particularly just. Um, why is that? And so our transportation and housing policies from the previous century, 1949, 1956, it led to redlining, which is basically uh, putting non-white folks close to the roads, close to factories, close to power plants, and wealthier, whiter folks further away. Also, if how does this impact the impacts of gas stoves, for instance? Well, if you have lower income, you probably live in a small house or an apartment. And as you saw from the Lawrence Berkeley data, um, the smaller dwellings had a higher percentage of the time that toxic levels of pollutants were present. You have more people in the home. Older homes are less likely to be well ventilated. Sometimes the heating systems don't work so well, and folks are using their stove or their oven to supplement the heat. And because of redlining, oftentimes lower income households are exposed chronically to higher levels of outdoor pollution, and then the indoor pollution is superimposed on top of that. And this is important because the cumulative exposure over a lifetime drives some of the outcomes. And the whereas the acute exposure is kind of the trigger for that asthma exacerbation. So this kind of is just piling on to already vulnerable folks. So how many, like, I don't know the uh, areas. I know that Gary's a fellow cardiologist, but I don't know what everybody. I think Bob, you're an internist, and I know. Yeah, I'm just trying to think who y'all must have seen this in your patients, right? You must have taken care of people with asthma and COPD. Um, I yeah, I had asthma as a kid, and I can still have it, but it's much milder as an adult. But I'm convinced that when we got rid of our gas stove, I did better. And I don't use a maintenance steroid inhaler anymore, for instance. So that's my anecdotal evidence, but I wouldn't base my much on that N of one, but there's a lot of data that tells me that's not all in my head. Um, so what do we tell our patients? So, we have the health impacts of burning gas. We have our practice, we have the external environment. Um, we're looking at, where all these things intersect. And the first thing that we as clinicians need to do is, understand who's at risk. And so we talked about children, but older people are at higher risk. People with diabetes and other chronic illnesses are at higher risk due to exposure to pollution. Obese folks also at higher risk, lower socioeconomic status, and anybody with pre-existing heart or lung disease is going to have a harder time with gas uh, in the home. Um, there's some great questions. I can't wait to get to that. Um, I just looked in the chat. So lifestyle, we talked a little bit about cumulative uh, and risks. So what people do outside the home or their other habits like smoking. So if you smoke plus you're cooking with gas, that adds up. If you work uh, in heavy industry and are exposed at work, if you have a hobby that exposes you to inhaled toxins, um, you're going to be at higher risk. So these are questions that we should be asking our patients. Um, so what can we do at, the patient level? Of course, treat their asthma exacerbation or their heart attack or their stroke. Also, when patients have vague symptoms you can't quite figure out, they're fatigued or confused, maybe like the carbon monoxide. You saw the list of things that come from carbon monoxide. Chronic exposure to indoor pollutants should be thought about in patients with difficult to figure out vague symptoms. Policy level, this is, this is CCL, so we're about policies. Um, we can, and I have personal experience with this, we can use the health voice uh, to impact policy changes. My state medical association passed a resolution a couple years ago acknowledging the health risks of cooking with gas and the climate impacts of heating with gas, and called for state level policies to reduce the dependence on gas. And we use that, and that strong statement from our org representing doctors all across Washington State. We use that when we went to our building codes council, and they're upgrading the building codes, and the health impacts were really key in them mandating that new buildings be wired compatible, the kitchens be wired compatible with putting in an induction stove, which is super important. And they mandated that all space and water heating in new construction be with heat pumps. But that may have been harder to pull off if we didn't have the State Medical Society behind it and doctors showing up and testifying to the Building Codes Council. And whoops, I've got to go back. A lot of, and this is where it gets a little bit tricky, for Citizens Climate Lobby, because we're, mostly focused on federal policy. The building codes are predominantly at a local, like a city, county level, some states, state level. The federal policy mainly can impact affordability. And there's stuff in the IRA where you can get, tax credits and rebates for putting in a heat pump or an induction stove. But the stronger policies are all, the building codes are all going to be at a local level. So if you're talking to your patients, like what can you do to reduce your risk if you can't get rid of the stove? Well, a carbon monoxide detector, good idea. Um, you know, if you have an exhaust fan, put it on. In fact, even if you have electric cooking, you're still releasing some particulate matter and stuff. And so you really ought to have, when you cook, you ought to have the fan on. Opening a window while cooking, cooking on the back burners, and then use, where feasible, use electric appliances like a toaster oven or an electric kettle instead of a burner. You could switch to an electric or induction stove. That kind of probably works for people in this room, right? You're doing well in your medical practice and you decide, I'm going to get rid of the killer gas stove and put in an induction stove, but they're not cheap. And sometimes you may have to do some rewiring. In my home, when we put in our induction stove, we were looking at a cost of the electrician work that could have equaled the cost of the stove. Fortunately, we had this energy wasting hot tub that we really weren't using much, that we wanted to get rid of anyway because we weren't using it much. And we had to repair the deck it was on. So it's like, that thing was wired. We had to run a much shorter lines for a couple $100. We were able to do the rewiring because we got rid of something incredibly wasteful in our own lives and then replaced it with the induction stove. But even with that, induction stoves are still more expensive than gas stoves for most brands. And so it's not going to be easily affordable for everyone. But there is a bit of a workaround. Staying on the induction stove. The other good thing about induction stoves is the burners don't stay hot. So you can, there's minimal risk of injury from this relative to, say, a gas stove or the older type electric stoves. There's a workaround for if you wanted to go to induction cooking, or your patients ask you, like, I want my kid to have less asthma. What can I do? Well, you can get for somewhere between 60 and $100 this single quote burner. It's not really a burner, but single unit induction. And this is one that I used in my home, or my family used for when the stove the cooktop that we wanted to put in was on back order. And this worked really pretty well. And then I gave this to our climate program manager at PSR when we had our stove put in. Now he's cooking with it and he loves it. So this is a good transition. The only downside to cooking with one of these hobs is that the methane leaks and the benzene leaks are still there, but the oxides of nitrogen and the particulates are markedly reduced. And use one of these in a ventilated space, you're mitigating a lot of the health risks of cooking with gas. I mainly focus tonight on the risks of cooking because that's the immediate health risk. But it turns out that our dependence on fossil gas, methane, natural gas causes health harms all along the product cycle. So it's fracking proximate to the well site. There's water contamination issues. There's actually air pollution issues there. During transportation, there's a risk of explosion, and there are methane leaks, which, as I said before, super potent heat trapping. When we burn it to generate electricity, the only thing I can say about natural gas generation of electricity is it produces less CO2 per kilowatt hour than coal. But I think the stat is if you leak more than about 10% of the methane through the pipelines, that wipes out the heat trapping advantage over coal. And we mainly focus when you're using it to heat your home, you're not getting a lot of toxic air pollution from, say, your gas furnace. It's mostly ventilated outside, so it's increasing outdoor air pollution. But that is, you burn a lot more gas for heating than you do for cooking, and that's your major climate change contributor from use of gas in the home. And then, of course, we focus tonight on when you're cooking food, that's your immediate health risk from gas. I mentioned that, I'm proud of my work with Physicians for Social Responsibility on building electrification. We were successful in Washington getting those building codes put through the Colorado chapter, the Greater Boston chapter, Pennsylvania, and San Francisco Bay chapters all have made great strides. Our work in Washington State is being threatened by a ballot initiative that would not only repeal the codes, it would make it illegal for state or local governments to do anything to, quote, promote electrification. So it not only bans banning gas, but it would ban doing anything at a government level for the health of people in my state. So you might imagine we're a little bit opposed to that. And I think our statewide Washington CCL is considering taking a position opposing that, but they haven't made a decision, so we're probably going to oppose it, but we have to vote. What about with Citizens Climate Lobby? Well, building electrification is one of our 4 policy focus areas. And as I said before, most of our opportunities are going to be at a state or local level. Here's a problem. Public policies, like the gas ban in Berkeley, or like my experience in Washington State, the policies have gotten out in front of public opinion. Most people that I talk to don't know any of the stuff that I just shared with you this evening. Don't know that gas is actually a risk to their health, and don't know that there's actually really good, effective alternatives for heating your home, for cooking your food. And I think the biggest push we're going to have from Citizens Climate Lobby is going to, in the next year or two, is material that we have at our tables, giving presentations on building electrification to the general public, and have public opinion catch up to the point where people realize that they really want an induction stove. Oh, but I can't afford it. It would be great if we had a tax break for it. And I think that's where our work is gonna have to be in the next couple of years. Is it okay if I open up the chat and start answering some of those questions, Lori? Would that be cool? Or I don't know how much time you wanted for me to go.
No, thanks.
Okay. So let's see. Lisa, I will give you a copy of my slides. Yeah, are induction stoves safe for people with pacemakers? It's a good question that I'm actively pursuing. The answer is probably. But the pacemaker manufacturers are very risk averse, and being willing to say, yes, nothing's going to happen to my device with that stove. And the Heart Rhythm Society is also being a bit cautious. So I think this is something that we're going to have to work on. Now a standard electric stove that doesn't have the magnet, doesn't have the induction mechanism, that's fine if you have a pacemaker. I think there's going to be a lot more information on this going forward. Yvonne points out that migrants are a risk group. Absolutely, 100%. So really good question about ventilation. How much does the ventilation fan located in the stove hood reduce the level of particulates and gases? So if the ventilation hood is above the cooktop, and drawing and blowing up. It can be fairly effective. Even in the Berkeley data, even in home, even when they had a good ventilation system, per current building codes, at least in California, there still were high levels of nitrogen dioxide and particulate matter still in the ambient air. So ventilation helps, but it's current ventilation systems aren't perfect. If you have an older ventilation hood starting to clog up, it's maybe not drawing as much air, so it's not reducing your risk as much. And if you have one of those, behind the hood or behind the stove, it kind of rises up as opposed to one over the top. Those don't work really well. Gas fireplaces compared to cook stoves. I don't have at my fingertips good data on how much your indoor air is impacted by gas fireplaces. I know that gas furnaces, if they're usually located in the garage or the basement and they're vented to the outside, don't really increase problems with the indoor air. So I think if your gas fireplace is vented outside, it's probably not causing much problem with your indoor air, but it's contributing to outdoor air pollution for sure. Yeah, the best alternative to gas stoves due to an unstable grid. Well, this is why CCL is advocating for permitting reform, because we need to have more transmission and we need to have a more stable grid. But the best alternative, like if you're to a gas stove, is one of those electric hobs, but that doesn't help you much if your power's out. So, Lucius, how often do you have power outages out by you, and how long do they usually last? And then I'll give you some tips based on that. Did Lucius leave? Oh, Lucius, are you still with us? This was your question.
If you're done with your slides, you want to stop screen sharing just so we can see people?
Oh, yeah. Sorry about that. Duh. Yeah, I'm done with my, I'm really just trying to go through the questions here.
Mark, this is Gary.
Yeah.
That question related to not having reliable electric power. Interestingly, I can't remember the manufacturer. It may not even be an American brand, but someone is coming out with a nice induction stove unit that also has a battery.
Yeah.
And the battery actually allows you to use 120 type electrical wiring. That was the main thing. Now, it's not an inexpensive stove, but compared to, GE Thermador or something like that, it was a bargain. So, I think it was around maybe $3,000, $2,000 or $3,000.
Right.
But
yeah,
may be able. I mean, the idea was to use it so you don't have to do the rewiring.
exactly. So, and the wiring, depending upon how your kitchen is set up, can be a huge cost.
Yeah.
But I think for Lucius's question is like, what's a good workaround? Well, a battery operated stove, depending upon how it's constructed and how big a battery, that could, and how long you have power outages. Like
Right.
if you're in an area where most of your power outages are fixed within 6 hours, you can probably get by with that. If it's six days, not so much. I think this is, but I'm glad you brought that up, the part about the batteries, because the technology is going to be improving. I'm confident, and it's going to get more popular. Just Cynthia, that's good. Just 3% leakage to make methane as bad as coal. Awesome. I'm going to change my talks from now on, taking away the 10%.
Right. And And
Yeah.
in fact, he said that the average leakage is over 3%. Now that they're using satellites, et cetera, they found that the leakage is routinely over 3%. It's been vastly underestimated.
Mark, I know you're doing it some of the time, but try and repeat the whole question for people that.
Yep, good. Thank you. For those that asked, I put my email in the chat. Yvonne asks how codes are being monitored. So the codes that I'm familiar with are for new construction. And so the way they're monitored is you don't pass inspection if you do it wrong when you build a new home. I think the resources for poor areas. This is where Yvonne asked, are there any resources for poor areas? This is where kind of the rubber hits the road. The lower income households are at higher risk of the health impacts, and they're least apt to be able to make the switch. Okay, so I can afford to put in an induction stove. Well, that's great, but most of my patients can't afford it. And so that's where we need programs that offer rebates and incentivize, maybe even some incentives for the people that are doing the home remodels and stuff to get them more kind of in line with putting in induction is preferred. Yes, Cynthia points out that renting a place with a gas fireplace, her daughter's asthma got worse. I believe it. I believe it. Lucian says he loses power 2 to 3 times per week. Yeah, that's for an hour or two. Yeah, that's not a particularly stable grid. I would slow walk to go into it. I might buy a hob and keep your gas stove as a way to preferentially cook without gas, but having that gas backup for your frequent power outages. Are emissions worse with gas top or oven cooking? Totally depends on how things are ventilated. Okay. If you have how much gas you're burning for how long and how well it's ventilated. So if you have a well ventilated oven, it can be better than a cooktop. If it's poorly ventilated, you open it up and you release all that stuff out into your ambient air. Can be dangerous. But a lot of ovens are electric these days. More electric ovens than gas. Lori, your hand's up.
Yeah, actually, this is Rob, but and Mark, with that in mind too, and going back to, I think, Melinda's comment earlier about other gas appliances.
Yeah.
Certainly, anytime we burn anything in the house, there's air pollution created, period. The difference with, for example, hot water heaters or furnaces is that they are required to be vented to the outside.
Mhm.
So that's the big difference versus a stove, which everything goes into the house.
Well, it turns out you can vent to the outside, but in a lot of places the code doesn't require it. So you can have this high power vent that's taking the pollutants from off the cooktop and just spreading it into the ambient air throughout your house, which in a small space that doesn't work at all. So yeah, again, heating your gas furnace is more of a risk to your entire neighborhood than it is to you directly because it's going into the outside air. Yeah. All right. Hey, this was really fun. I hope I didn't go too long.
No, this was great. Any other questions, people?
I guess I'd ask the question, what do you think is the best way to get this information out to the public? As you say, not enough people know about this.
Yeah, I can tell you what we're doing with our building electrification efforts in Washington with CCL is got handouts from Rewiring America and from CCL at our tables. So the people that stop by our tables, are usually interested in climate change. And it turns out more people are interested in what they can do in their home than want to write Congress, I've found over the year. And so we're just getting going with this. I think most people in the general public, one, don't know how risky cooking with gas is, and two, don't know what's out there in terms of programs. And you have to know what's going on in your state, your county, and federal rebates. And I think that's stuff that we really should all CCLers should have that at our tabling events. That would be a tremendous service. All right.
Oh, can I ask one more question? As long as we have a little bit of time.
Yeah.
This is this is just ever so slightly facetious, but have you been thinking about new cliches and sayings as we're going to electric appliances, like now you're cooking with gas, now you're firing on all four cylinders, etc.
Yeah.
We need a lot of new cliches that capture the beauty of electric.
Yeah. 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 I don't know. We have to go talk to some smart PR people. That's not my forte for sure. Good. If a couple people asked for copies of my slides, if I put my email, if you just fire off an email to me, I will send you a copy of these. They're not patented or anything.
If you're willing to let everybody have them, if you want to send them to me, that'd be nice.
I will definitely send it to you. Yeah, perfect. Yeah, I don't mind sharing. Take the charts and graphs and reformat it to for your own use. I'd love to have everybody else giving the same talk.
Yeah.
All right.
And Mark,
Bob, were you going to make an announcement?
What's that?
Bob has an announcement, I hope.
Well, yeah, just want to say thanks to Mark. It's a great presentation. So just a quick heads up, Cynthia and Margie have been spearheading the Get Out the Vote with a focus on the health community. And as it stands now, we plan on having a webinar at 8 p.m. Eastern Time on September 18th. And it's going to include Cynthia, I think it's going to be a lot of the presentation you and Margie and others had given back in May, I believe. Also, Dan Quinlan from Sola Vida is going to speak to the importance of the voting. VCCA has gotten involved in this, and we've got a toolkit, a number of resources, some of which come from the consortium. That'll be presented. Also, we're going to have people from Arizona and Vermont speaking about health impacts in their locations. A very interesting part of this is, and this was in Cynthia's presentation, is how significant voting is as a social determinant of health. And there's a very nice chart that they include in their presentation that shows that I think it's the voting registration numbers, if not the number of people who vote, directly correlates with the level of health outcomes in that particular state. And also something else a little more disturbing that she presented was the number of health professionals or physicians who did not vote in 2020. So we've got some work to do to get our health professionals involved. And this webinar is to help us understand what needs to be done. And then we're going to also then reach out to the state affiliates to see if they would want to present this to their membership, record it and make it available to them. So anyway, September 18th, 8 p.m. Eastern Daylight Time. So very civil on the West Coast at 5 p.m.
Sorry, guys.
Bob, is the we VCCA or what?
The we,
yeah.
Well, it's all, it's Cynthia and Margie and Karina Mayer are going to be presenting, as well as Dan Quinlan. VCCA has a very small segment, just a couple of things we've done, maybe some social media messages in the toolkit we've put together, stuff like that.
Okay, well, make sure and do it as a forum post if one of you will.
Yeah, when we're ready, I know we have a planning meeting tomorrow, so We've not yet finalized the announcement, but I think it could be any day now.
Yeah, hopefully by tomorrow.
It's always
Okay.
fun to see success from, that things are contagious. And when we had Dan Quinlan and his buddy on the other week with the Climate Superfund Act in Vermont, Mike Menzel, who's a I don't know, one of the docs in Minnesota in our CCL group, in our CCL health group, and he actually got a legislator in Minnesota to carry forth a bill. So they're going to try and work on this too, which was really encouraging. Mark, I wanted to ask you, besides what you said you had for tabling, since your chapter or state with CCL is big enough to have various committees, I guess, what else are you doing in regarding to the building electrification and efficiency in CCL in Washington State?
Yeah, we've only just started ramping it up. So our first couple of months was just figuring out what were our best levers to pull. And my bias was toward influencing public policy just based on our success with the Building Codes Council, which was not a CCL effort. But I said, we got all these grassroots folks across the state. We can really do this. And it was really the pushback and the realization, this ballot initiative, trying to roll back some of the gains, that we have to take a couple of steps back and have to convince the general public. So I think where we're heading, at least in Washington State with our CCL volunteers, is to tabling and giving talks, educating the public. And if public opinion is starting to catch up, then we can pivot back toward the state legislature and city and county governments. But I think we're going to pause. We're going to pause our policy efforts for a bit because we're getting burned, getting over the handlebars, so to speak.
Understand. Any comments from anybody else? Anything noteworthy in your area, or any questions, anything else? Okay. It would be a rare time when we are letting people out early.
If I had known, I would have just thrown in a couple more slides. I'm just kidding.
Yeah, who's
All
a
right.
doc to waste time we can be presenting, huh?
Right. All right. Thanks for inviting me. I should stop by more often.
Thanks a lot, Mark. That was very meaningful.
Thanks,
Good night,
Mark.
everybody.
Really helpful. And thanks so much, Lori and Rob.
Hey.
Thank you too.